Hey everyone, welcome back. We're diving into some really fascinating stuff today.
Oh, yeah.
We're going deep into the concept of acupuncture depth.
Okay.
And to do that, we're going to be looking at the Yellow Emperor's classic of internal medicine.
Right. One of the foundational
Yeah,
texts.
absolutely a classic text, pun intended.
Mm-hmm.
And specifically, we're going to be looking at chapter 51 from the basic questions section,
Okay.
where the Yellow Emperor himself is asking his physician, Shibo,
Right?
about the concept of needling depths and how to make sure you don't injure different tissues.
It's kind of a conversation that I think a lot of people would be
Yeah.
curious about even today.
Even today, yeah, like how deep are those needles going?
Right.
What's
Exactly.
happening there?
Yeah, and I think it starts off, you're dropped right into a conversation
About into it.
between the Emperor and Kibo.
Yeah.
And the Emperor is like, okay, so tell me about needling depths.
Yeah, he's curious.
Yeah, he's like,
Well,
that's the deal with that.
break it down for me.
Yeah.
I'm the emperor and I want to know.
Exactly.
And so Chibo,
He starts, like any good teacher
Yeah.
would, with like the foundation.
with the basics,
Yeah.
laying it all out.
He's like, okay, so first of all, you have to understand that the body is composed of these different layers, right?
Right.
You've got bone, tendon, flesh, vessels, and skin,
Okay, so he's naming the different tissues.
naming the tissues.
Okay.
And what's interesting here is that he really emphasizes
Yeah.
that each layer needs to be respected.
Respected.
Yeah, like you don't want to injure one
Right.
while you're trying to treat another.
That makes a lot of sense.
Yeah,
I mean, even in modern surgery,
totally.
you have to be so precise
Oh, yeah.
to make sure that you're not damaging
Yeah.
surrounding tissues.
So this is like, thousands of years ago, and they're already thinking about this stuff.
Exactly, yeah.
Yeah.
And I'm curious, have you, ever had acupuncture yourself?
Oh, yeah. Many times.
Yeah, and so does this, idea of layered needling.
Yeah.
Does that kind of resonate with you?
Totally, because you really do feel it, You feel the different layers.
Yeah.
And sometimes you feel that, it's getting close to the bone.
Oh, maybe
And you can kind of sense that depth.
That's fascinating.
Yeah.
Okay, so we have Chibo
Yes.
laying out these different layers.
Yeah.
But the emperor, he's still a little bit confused, right?
Yeah, yeah.
And I think it's easy to be confused by this because it's very subtle, right?
Yeah.
And so he kind of pushes Chibo
Right.
to explain a little bit more.
He's like, okay, but give me some more details. Like,
Yeah.
how do you actually do this?
And it's here that I think, Chibo's explanation gets really interesting.
Oh, yeah, it gets super specific.
Do you want to kind of break down, what he says?
Yeah. So he starts talking about how
Yeah.
needling near something, right? Like needling near the bone, for example, doesn't actually mean you're sticking the needle into the bone.
Right.
It's about getting close to it to
Okay.
influence its function.
Okay, so it's not like you're piercing the bone.
No, not at all.
You're getting close to it.
You're getting close.
Okay.
And I think he uses this really vivid phrase.
Yeah.
He says, needling near the bone without injuring the tendons.
Oh,
So
interesting.
you can imagine,
Yeah.
you've got these delicate tendons
Right.
and you're trying to get the needle close to the bone without harming them.
It's like threading a needle through the body.
Yeah, totally.
It's so precise.
It's amazing.
Yeah.
And this really shows, I think, their deep understanding of anatomy, right? It's
Oh.
not just about knowing where the bone is. They understand the relationship
Yeah.
between the bone and the tendons.
You know how they're all connected.
Exactly. And then he introduces this concept of what's called reverse needling.
Okay, reverse needling. I'm intrigued.
Yeah, so reverse needling is this technique where you're actually passing the needle through one tissue layer
Okay.
to target a deeper one.
So you're going through one to get to another.
Exactly. It's like a
Right.
thread, right?
Yeah.
You're weaving it through the tapestry of the body.
That's such a great image.
Yeah, and you're bypassing certain areas to precisely influence others.
Okay, so can you give us an example? How would they actually use this?
Yeah, so he gives a couple of examples in the text.
Okay.
He talks about, for example, needling the flesh without injuring the tendons, or needling the tendons without harming the bone.
Okay, so you could, imagine if you had, a really deep-seated muscle spasm.
Yeah, totally.
And it was, right next to a sensitive nerve or something.
Right.
You could use reverse needling to get to that muscle.
Exactly.
Without
We're not
it-
damaging the nerve.
Yeah, without hitting the
Yeah,
nerve.
exactly. Yeah.
That's incredible.
It's pretty amazing.
And that requires such skill.
Oh, so much skill.
To be able to do that.
Yeah, and control.
Yeah.
And an understanding of anatomy.
I mean, I'm just, thinking about how do they even figure this out
Yeah.
back then?
Right.
That's a level of, anatomical precision
Yeah.
that I think a lot of people might not
Yeah.
associate with ancient medicine.
Right, and I think it challenges this assumption that ancient practices were somehow simplistic or
Right.
unsophisticated. I
Yeah.
mean, clearly, Chibo had like a remarkably advanced understanding of the body.
Yeah, so we've gone from like this basic idea of layered needling,
Right?
resecting the tissues, to this incredibly complex and like almost elegant concept of reverse needling.
Yeah.
And it just like makes me wonder like how might these principles, right?
Yeah.
From this ancient text
Yeah.
still inform modern acupuncture practice today?
That's a great question.
Something to think about
Yeah.
as you like continue your exploration of
Yeah.
acupuncture.
For sure.
All right, well, thank you so much for joining me on this deep dive today.
My pleasure.
It's been a fascinating conversation.
Absolutely.
And until next time, keep exploring.
Yeah. Keep diving deep.
All right, see ya.
See ya. Bye.
Bye.